The consortium accumulated data about 4,000 newly diagnosed glioma cases and 4,000 frequency match controls. These are healthy patients, healthy people that are recruited in the same hospitals that these patients were treated, or in the population, depending on the study site. So the study question is whether or not aspirin or other non-aspirin, non-steroidal anti-inflammatory drugs is shown to be associated with the risk of this disease. So prior to this very large international study, there are several, actually quite a few smaller studies done in the US and elsewhere in Europe. They have been, the results has been conflicting, but there's some evidence to show that aspirin, the NSAIDs, may be associated with a lower risk of glioma. But because these studies are so small, it's not clear that if these results can hold true in a larger population, particularly population in different places in the world. So the advantage of this study is that it's a very, very large study that allows us to explore the question in deeper details. Like, for example, looking at patients who's been exposed to the drug for a long period of time, because it will make sense that if there's association, it will be among those who have taken the drug for at least 5 to 7 years. We learned that from cancer prevention studies in other more common cancers.